Hi, we're inviting you to watch this video as you have recently experienced a flare-up of your respiratory condition. We would like to talk to you about one of the best treatments that has helped many people with a similar condition. And it may surprise you to hear that this treatment is not a drug. It's called pulmonary rehabilitation. Would you like to hear more? Your doctor has told you that you have chronic obstructive pulmonary disease, or COPD. COPD is a common lung disease that makes breathing difficult. There are two main forms of COPD: obstructive chronic bronchitis and emphysema. These conditions are a result of the damage caused by exposure to cigarette smoke, other irritating gases, or particles. People with COPD experience flare-ups of the disease, also known as exacerbations. During these periods, symptoms such as cough, mucus, and shortness of breath are worse. People may feel very tired from these symptoms, and for many, normal day-to-day activities become extremely difficult to perform. In many situations, people need to go to the emergency room and end up being hospitalized. Do you recognize yourself in this situation? There are solutions for you. Your doctor and healthcare team will help you find the right medications to help you with your symptoms during the flare-up. They'll also help to find the right medications that you'll need in the long term to maintain your health. And there are a number of things that you can do to speed your recovery and feel better. You can take your medications as prescribed, learn about your disease and how to deal with symptoms, and remain active, including doing regular exercise. A pulmonary rehabilitation program is a good way to learn about these topics and can help you feel better and maintain your health. What is a pulmonary rehabilitation program? Pulmonary rehabilitation is a program that includes exercise, education, and support from healthcare providers and other patients in the program. It's one of the most successful interventions to improve your shortness of breath, your fatigue, quality of life, mood, and motivation, as well as your capacity to do day-to-day activities that you enjoy. Why do doctors recommend that you move more when you're currently feeling so ill? Many people in your situation can feel weak, sad, and even isolated. And although it seems logical for you to rest during and after a flare-up, research has shown that people who are active right after a flare-up recover better. This is exactly why moving more at this point is essential. Health professionals at pulmonary rehabilitation programs can help you get more active in a safe way. Being more active during and after a flare-up of the disease has been shown to decrease shortness of breath, improve fitness, improve quality of life, and most importantly, reduce the risk of another flare-up or being admitted to the hospital. Let us hear the story of John.
Hi there, my name's John and I'm 69 years old. I was first diagnosed with COPD 5 years ago, and since then I've had difficulty coping with my condition. It's been so long since I've been able to play with my grandchildren, and I long for the day when I can chase them around the living room again. One day I started coughing and noticed that I was producing more sputum than normal. I thought this would go away, but it didn't. Instead, it lasted for about 3 days before I woke up one morning feeling so short of breath that I ended up in the emergency room. I thought for sure this was the end. The healthcare professional who treated me said that I was having a flare-up, that I'd be okay. I ended up being hospitalized for 5 days, where they gave me specific medications to treat my flare-up. The healthcare professional said there was something else that I could do to help with my recovery. They suggested that I start a pulmonary rehabilitation program. I was a bit skeptical, but my healthcare team reassured me that it could help me achieve my goals and reduce my symptoms. When I was sent home from the hospital, I started the program, despite still feeling more tired and short of breath than usual. It was a long road, I'm not going to sugarcoat it, but by the end of the 8 weeks, I can definitely say that it was worth it. I had the opportunity to do exercises to strengthen my muscles and get more fit. I also learned many different things along the way, including tips to help reduce my shortness of breath, which now allows me to go up and down stairs more easily and even play with my grandchildren. Although I still have some of the same symptoms, I'm now able to recognize if they are getting worse earlier and feel I'm better prepared to deal with them. This makes me less fearful that I'll find myself back in the hospital.
So what do you think? Would you be ready to hear more about pulmonary rehabilitation? Let us first talk more about what this program looks like. A pulmonary rehabilitation program is tailored to your particular needs and abilities. A qualified healthcare professional will work with you to create a program that works for you. As you progress through the program, this person will continue to work with you and adjust the difficulty and type of exercise as needed. It's important to remember that exercise is an important part of your rehabilitation. You may feel a little short of breath at the beginning, but not to worry. That will get better over time, and you'll have support at all times from healthcare professionals to help you and to ensure your safety. Usually, a pulmonary rehabilitation program lasts between 8 to 12 weeks, with 2 to 3 sessions per week. The program combines exercise and education classes given by different healthcare professionals, such as a doctor, nurses, physiotherapists, respiratory therapists, and others. These professionals will help you improve your symptoms and your quality of life, and help you regain the ability to do the activities that you enjoy. You will meet other people with lung disease at the pulmonary rehabilitation program, and you may find you learn a lot by talking to patients who share similar experiences as you. Let us hear the story of Rita and how she was able to participate in a pulmonary rehabilitation program.
My name is Rita. I am 58 and I completed my pulmonary rehabilitation program 1 year ago. I started my pulmonary rehabilitation program just a couple of months after I went to the COPD clinic because I was feeling more short of breath than usual. Luckily, I recognized that something was wrong early enough and I didn't have to be hospitalized. At the clinic, they sorted out my medication and I was able to go home that same day. Shortly after my visit, I received a phone call suggesting I participate in a pulmonary rehabilitation program. I was a bit surprised by this call as I didn't know I qualified for a pulmonary rehabilitation program or that I even needed it. I had been active for most of my life until learning I have COPD. So a pulmonary rehabilitation program was not a scary thought for me, especially because I knew it was something I could do to try and help myself. My healthcare team was exceptionally helpful throughout the program, always explaining what they were going to do and what the next steps were. For example, they explained each exercise session we were expected to try and how to do a little bit more. Even before my flare-up, I had started having difficulties doing simple housework like vacuuming and ironing. I would need someone to help me put the ironing board up because it was simply too strenuous. Now I can carry it down the hall to the living room and put it up myself, no problem. I feel so much better. I continued to try and do my exercises regularly and tried to get a short walk in as often as I can.
What do you think? Are you ready to give it a try? If you're ready, talk to your healthcare professional about pulmonary rehabilitation, or you could also contact your provincial lung association. They'll give you information on how you can start and the available options. If you're still unsure about participating, you can discuss this video with someone close to you and contact your healthcare professional when you feel you're ready. Now, before we end this video, we invite you to visit this website, www.livingwellwithcopd.com, where you can find more information on how to live better with your disease on a daily basis. Thank you.